My name's Lauren, and I'm going to talk a little bit about the housing burden of the city of Glendale. When we're thinking about housing burden, we are thinking of people who are either at risk for homelessness or who are currently homeless, which means that they have no permanent residence, no address, or that they have the housing burden of being at risk for homelessness by their total income not being sufficient enough to pay for their rent every month, and so therefore they have to make choices on whether to eat or pay the rent, or whether to provide clothing for their children or pay the rent. So that's what we're thinking of when we are thinking of the housing burden. When we're looking at the long-term effect of homelessness, the level of prevention, which would be ideal, would always be primary. Not only is this type of displacement long-lasting, but it's very difficult to overcome, and it can result in many additional unfortunate circumstances. Specifically for public health nurses, we're looking at things like lowered wellness and overall health issues. And we know this is a problem because research has shown that homeless adults face an increased mortality from all causes, and those with severe mental illness display a significantly worse quality of life compared to non-homeless individuals with mental illness. So therefore, we can tell that there is going to be a significant decrease in quality of life and health outcomes for this population. So when we're thinking of prevention, primary prevention is where we would ideally like to intervene. This isn't always possible, but the public health nurse can participate in activities that will increase the wellness of their community and therefore decrease homelessness. And the public health nurse is often the one that will meet somebody in the home when they're experiencing a housing burden and be able to intervene so that that issue does not become worse. Now, that can technically be considered secondary interventions as well, because it's sort of a diagnosis for the community. And therefore, it's also important for the public health nurse to be connected with her community and to be able to identify people that are at risk for homelessness. And if these measures aren't enough, then the public health nurse can also use a mix of practice-based and intervention-based strategies in order to rectify the ongoing homelessness issue in her community. The public health nurse will need to work with local clinics and hospitals to discover these patients who do not have a stable address. The public health nurse can also work with organizations such as homeless outreach programs, the Glendale Police Department, as well as mental health services to identify individuals in need of housing. Now we're going to talk a little bit about how to implement the strategies to combat the housing burden and homelessness in Glendale. The City of Glendale has recognized for many years the importance of housing for its citizens and has made efforts to decrease this burden for residents. In the 2014 to 2021 Housing Element Report, there was identification of the impact of the housing burden that it has on the city. One being that in the year 2000, the census count had Glendale as the third largest city in Los Angeles County, and in 2010, Glendale dropped to the fourth largest city in Los Angeles County. The city understood this as people leaving the city of Glendale in order to achieve lower rents and ability to avoid homelessness. Wanting to retain and increase their population counts, the City of Glendale has organized programs such as the Monthly Housing Subsidy Program Lottery, the Vista Grande Court Apartments, the Rental Rights Program, Section 8 housing, fair housing, and other resources to keep the residents in their homes. The person in charge of overseeing all these programs is the Administrative Director of Community Development named Peter Zobak. He oversees the groups who carry out these programs, and these groups work with a network of the City Council, the Housing Authority, Planning Commissions, City Administration, Housing Division, and local hospitals. Considering that there are many well-established relationships in the City of Glendale, many community workers understand their roles in collaborating to make progress on these initiatives, which is a strength of the city to be capitalized on. Given the ability of the City of Glendale to create programs over the last 10 years suggests that there's enough resources to do so. The gaps that are likely to exist and would need to be filled would be any new interventions that were implemented in the city. And these gaps could be filled by public health nurses, community members, or other public health workers. These interventions would specifically be to identify those who are at risk for homelessness, and so the amount of staff needed would be minimal. The last part we're going to talk about is the action plan. And the action plan in Glendale can consist of practice-based strategies and intervention-based strategies. The first action plan is practice-based. The action plan is to support the city policies to expand the supply of affordable housing. The City of Glendale has put into place housing goals to be reached between the years of 2014 and 2021. So there's already a system in place to help lower the housing burden in the City of Glendale, and the role of the public health nurse would be to support these efforts, as well as to make sure that patients are funneled into these programs so they can get the support that they need. In order to do this, the public health nurse needs to maintain relationships with city officials and the leaders of the individual programs, as well as keep a strong community network and stay up to date on any changes that the programs may make over time. For primary prevention, one of the programs which is great is the Renters Protection Program. And this program provides guidelines for renters so that they may understand if they are being evicted unfairly. This can be particularly helpful for the public health nurse or a nurse in the hospital, so that they may give their patients resources to avoid having unnecessary homelessness. Training for this would involve public health nurses and hospital staff to understand the Renter Protection Program and to be able to use the guidelines effectively to identify patients who would benefit from this. One of the other action plans would be intervention-based, and this would be for nurses in clinics and community settings to administer surveys to patients to identify who is homeless or at risk for homelessness. Part of the need for this is because that the counts of homelessness are not considered accurate. The City of Glendale did provide an annual homeless count. However, they also recognize that this count is only done once a year, and it doesn't include every homeless person in the City of Glendale. So therefore, those who may have already been in the hospital or may already been in a community setting might have been precluded from the count, and we can increase the action plan to include a more variety of settings. So in order to do this, we would have to make a survey, and over the next 6 months, the survey could be administered. The first month would be committed to developing the survey, and then there'll be specific check-ins along the way so that those administering the survey would be able to understand, ask questions, understand the effectiveness of the survey, and maybe adaptations could be made along the way. Analysis will be done after 6 months to evaluate if there's been an increase in homelessness compared to the annual survey, and to collect data on how many persons are connected to local resources. In either of these action plans, indicators of success will be increased awareness of homeless counts and increased connection to resources. Long-term indicators will be reduced homelessness in the City of Glendale and reduced housing burden.